Hey, I'm Dr. David Seji at Momentum Chiropractic in San Luis Obispo, and today we're going to talk about hip pain. Now, the hips are a common misconception. Where are they and what they do? But if you're having hip pain, it really is aggravating on a day-to-day basis. You just want to be able to walk, run maybe, do the things you love doing, and if you're having hip pain, this seriously keeps you from doing it, and it is not fun. So I feel you when you have that. Now, the hips are actually these two joints right here, okay? They're actually a ball in socket joint. And if you're feeling pain on the front, the sides, or the back, that could be the actual ball and socket hip joints. But a lot of the times people will associate their hips with the wrong area, whether it's a little higher and they're like, it's kind of the glutes area, or it's a little higher than that, or if it's somewhere else, like further down the leg. We have to really do an exam and find out exactly what's causing the pain, because a lot of times, even though you may feel pain in the hips, it's not coming from the hips. It all starts with a careful evaluation, probably taking some x-rays. We need to see what's going on, and we need to see how the bones and the joints are doing, whether there's any arthritis or degeneration happening, because that builds up over time if it's not properly maintained. If you're having hip pain, make sure that you get x-rays, get it evaluated by a great chiropractor that can look at it, make sure your hips are aligned and not causing excess strain on one side versus another, because that's terrible. And we need to make sure also that we can prevent any future hip-related surgery if we can, because that is not a fun process to have to recover after getting hip surgery. Let's make sure we get evaluated. Let's make sure we get it taken care of so that you can do all the things you love doing and feel your best.